All right. Good afternoon, everyone. This is Dr. Patrick Lockwood coming back to you live again to discuss addiction. As some of you may know, if you've read about me or listened to previous videos, I work at a treatment center for addiction, and it's one of my specialties. It's what I did my dissertation research on in my doctorate program. So I wanted to come live and actually talk about it because I think, with the opioid epidemic and with other things going on in the world right now, there's a lot of talk about addiction, and I think there are a lot of misconceptions about addiction, a lot of myths that I'd like to debunk here if I can. And I want to keep this simple because I could literally spend hundreds of hours talking about the research on each different type of substance that people are addicted to, how the cannabinoid receptor works in the brain when we smoke pot, or how GABA is activated whenever we drink alcohol, or smoke pot, or take benzodiazepine drugs. Hey, Cha-Cha. So I could spend a lot of time talking about all these different pieces of science about addiction. But for just today, I want to talk about what addiction really is, because I think there's not a clear consensus out there in the news media or by even professionals, sadly enough. So I want to give everyone two things today. I want to give you the science of addiction, as in how it actually works, and then what we can do differently to either help prevent it in the future or manage it better now if we're struggling with drugs and alcohol and other things, or if we know someone who is struggling with drugs and alcohol and other things. So I hope that's clear to everyone that I'm not going to spend intensive amounts of time talking about the different brain chemical processes, structural changes, things like that, because that would take, again, hundreds of hours to do it justice, because there is lots of research. So many studies have been done in the last 30 years on the brain and drugs of abuse and addiction that it literally would take hundreds of hours, and I don't have the time, and I don't want to bore you with any of that stuff. So today I just want to really try and focus on what really is addiction and what are the myths and how can we bust some of them. So let's talk about the very first myth, and I've seen some posts on this recently, and there are memes on this and things of that nature. A lot of people seem to think that addiction either is a disease or is not a disease. So first, in order to know if addiction is a disease, let's actually define disease first. So a disease, according to the Oxford Dictionary, a fairly reliable source, is a disorder of structure or function in a human, animal, or plant, especially one that produces specific symptoms or that affects a specific location. It is not simply a direct result of physical injury. Okay? So let's do that definition in one more time. A disease, according to the Oxford Dictionary, is a disorder of structure or function in a human, animal, or plant, especially one that produces specific symptoms or that affects a specific location and is not simply a direct result of physical injury. So when I talk about the research later, I want you to keep in mind this definition because technically speaking, not necessarily speaking from the 12-step model of addiction or anything else, but just from the science and what we know, addiction is absolutely a disease when you talk about the brain science of addiction, to the point where now even the Surgeon General of the United States last year came out and said, we believe addiction to be a brain disease, because the last 30 years of research shows that when someone begins maladaptively using substances, it creates specific structural changes in the brain, in the dopamine pathways in particular, and in the opiate pathways in particular. There are literal structural changes and structural differences. We have hundreds of fMRI studies and things like that that show specific brain changes as a result of using drugs and alcohol in a maladaptive manner, in a compulsive maladaptive manner. So according to the Oxford Dictionary, addiction is absolutely a disease. So then the question becomes, what is addiction really? Because many people use substances and consume things like alcohol and cannabis and painkillers and benzodiazepines and psychedelics and all sorts of different things. Caffeine is, an addictive substance, nicotine. Many people consume these things and never have their life get out of control and never have horrific consequences like many of the patients that I work with. So I guess we need to define addiction. So there are different ways to go about it. And you can go by the American Psychiatric Association's DSM definition. You can go by the Surgeon General's definition. You can go by SAMHSA's definition. You can go by many different definitions, but here's the simplest science-informed definition of addiction. So addiction technically is a maladaptive and compulsive pattern of behavior, thoughts, and urges related to using a substance or multiple substances in such a way that creates negative consequences and impairs functioning. That simple. So someone who can go out to the bar every night after work and is not fighting with their wife because of it, or is not having liver problems, is not struggling to maintain their job or employment, or have healthy relationships and things like that, they're totally fine. That's not an addiction. Every once in a while it might get a little out of control, but that's not technically addiction, using the definition I just gave. So I hope that's clear to everyone. I hope it makes sense, because again, my goal here is not to pathologize people who every once in a while will smoke pot, or every once in a while, once a week or once a couple times a month, will go have a drink with their friends. That's not my goal, because again, if your drug and alcohol use behavior is not causing problems for you and is not interfering with your ability to have relationships, maintain your role requirements, and live a healthy lifestyle of wellness, then fantastic. So let's talk about the science of addiction very simply and very briefly. So I mentioned earlier, when trying to define it as a disease, that there are certain structural changes in the brain that happen for someone who is an addict, someone who struggles with drug and alcohol addiction. So the short story is, when someone begins excessively, compulsively, maladaptively using drugs and alcohol and other things in order to manage their feelings and do things of that nature, here's what happens. Parts of the midbrain, things like the nucleus accumbens and the other mesolimbic dopamine pathways in the brain, start to change and become more sensitive to that substance of abuse. And it actually starts to change how neurons connect, and it changes how neurons respond, because it's happening in a pattern, compulsive, maladaptive way. And this pathway, this dopamine pathway, typically called the reward pathway, even though it's not, is what becomes initially hijacked by consistent excessive use of drugs and alcohol, especially when it's in the context of being used to manage feelings or deal with life. So the second pathway that starts to get changed in anyone who struggles with drug and alcohol addiction is the opiate system. So the opiate system is responsible for three things in life. The opiate system is responsible for feeling less pain, so it modulates pain, as you all kind of know. It's also responsible for decreasing threats to safety, so decreasing anxiety. And it's also responsible for, most importantly, our ability to feel connected and engaged and safe with people. So I'm going to say that again so everyone gets it. Our opiate system, the things that are activated by heroin and OxyContin and oxycodone and Vicodin and all this stuff, all these drugs. The opiate system is responsible for three emotional and cognitive processes. It's responsible for managing pain in the brain and the body. It's responsible for managing threats and feeling safe, so it's responsible for helping diminish anxiety. And it's particularly implicated in feeling safe and connected with people. And I'll give you the simplest example that hopefully makes it clear why. Every time you're with someone, say you're with a lover or with a good friend or a family member, and you just have this moment with them where you kind of melt into their arms when you're hugging or kissing, and nothing else around you matters. You're not focused on the traffic or on what you look like, what things sound like. You're just there in that moment, and that moment is perfect. And the only thing that matters is that sense of warmth and connection with that person. That is your opiate system going off. That is your endogenous, internally created opiate system going off. And that happens every time we feel safe and connected with someone, we get a legitimate hug from someone. Every time we make love and feel connected to someone, the system is going off. So I hope that's clear, what the opiate system is responsible for. And what the wide swath of research shows is that the opiate system becomes hijacked in people who are addicts very quickly. Because again, what happens is that drug of abuse that we're using to manage our feelings, to deal with life, or whatever it is, that's now become out of control, now starts to take the place in our mind, in our biology, of our emotionally satisfying relationships. We feel the most safe when we're getting high. We feel the most connected and present when we're getting loaded. So that's what the opiate system is all about, and that's why it's a big deal. So in terms of how addiction develops, so we've got two biological processes. We've got a problem of your dopamine system, which is technically your seeking system. Go out, get this thing that's good for me, right? That's what your seeking system does. Every time you're hungry and you want to go get food, that's your seeking system. Every time you're lonely and you want to go hang out with friends, that's your dopamine seeking system. Every time you're horny and you want to get laid, that's your dopamine seeking system. So your dopamine system gets hijacked by consistent maladaptive use of drugs and alcohol, and your opiate system gets hijacked by consistent maladaptive use of drugs and alcohol. So then it becomes the question of, how does this happen? How does this really work? How do we become addicted in the first place? How does this really develop, I think, is a fair question. So I'm going to post research here on Patreon, as well as the stuff about the dopamine and opiate system, that talks about dozens, if not hundreds, of different theories on how addiction develops. And here's what I find to be most true based upon both my clinical work and the research I've read, both prior to my dissertation and since then, since I've been in practice. Addiction typically develops in adolescence. It's statistically rare for someone to develop a compulsive, maladaptive drug use habit after the age of 25. And all the epidemiological statistics show that as well. That the people who, for instance, break their leg at 30 and get hooked on painkillers is statistically very rare compared to the number of people who go into treatment for drug and alcohol issues who started when they were 16, 15, or 8. I have a client right now who started abusing nasty substances at the age of 8, right? There's just so many stories of that nowadays. And I think people are starting to use drugs and alcohol earlier and earlier in maladaptive ways. So for me, the broad theory for how we become addicted is an inability to manage thoughts, feelings, and experiences, an inability to manage shame, our attachment insecurities, whatever they are, in early childhood and adolescence. And then, because we don't know how to manage these thoughts and feelings, we don't have safe relationships. Maybe our parents are great people, but they're not as present as they could be. Maybe we find ourselves with the wrong crowd of people because they feel just as bad as we do, just as guilty, just as depressed as we are in adolescence. We start using substances consistently to deal with our feelings because that's what our peer group does. And that's how they feel better. The problem is, in adolescence, the brain is very, very plastic. It's very malleable. So it's this frontal system responsible for thinking, planning, managing feelings is very, very malleable in adolescence. And that's when the majority of people begin maladaptively using substances, even if they're not addicts at the time, even if there's no structural brain change. But what they're doing is they're influencing their neurochemistry, because this frontal part of the brain, especially right here behind the eye, the orbital frontal cortex, is supposed to drive us to go seek out people, to feel safe, to feel connected, to feel understood, and to regulate our feelings. And when those parts of the brain are being bombarded with pot and alcohol and club drugs and heroin and things of that nature, we're starting to de-emphasize the importance of our frontal capabilities and oversensitize our midbrain dopamine and opiate pathways to feel better. Those very automatic reptilian pathways that are just behavioral and not very premeditated or thoughtful. So we're teaching adolescents, by allowing them to use drugs and alcohol at all, that this is a way that their brain can feel okay and feel regulated. So my thought is, I get that, again, every kid's going to experiment. pretty much, and want to try things and do things. But I think it's imperative for us as a culture to talk about the brain pathology that can occur if adolescents are allowed to use substances like that in any kind of consistent way. Because if they do, they're putting themselves at great risks for being hijacked, neurodevelopmentally speaking, to the point where they do become biologically addicted. So my theory of addiction is this. Regular, healthy kids, super unhealthy kids, all across the spectrum, find themselves in strange social circumstances, challenging emotional circumstances, so they start to hang out with people who are using drugs and alcohol. Maybe their family members do it, maybe their friends do, maybe other peers do, and they start using drugs and alcohol consistently to start managing their feelings. So they develop, with continued use, they develop a pathological relationship to intoxication because, again, the two parts of the brain that get hijacked, chemically speaking, are the parts of the brain responsible for relationships. So my mentor, a man whom I love dearly, is John Daly, and he describes addiction in his book, which will be one of the references later, as a pathological relationship to intoxication. Because again, the dopamine system and the opiate system become hijacked without fail by anyone who uses drugs and alcohol in a consistent way. It just happens without fail. So I hope that's clear. And my direction for the future is this. If we really want to help decrease the heroin epidemic, the opioid epidemic in this country, if we really want to make our lives better, if we really want to beat drug addiction, this drug war bullshit that the government puts on, if we really want to beat this thing, we really need to be focusing on developing these brain areas in adolescence appropriately. We need to help kids learn how to be self-regulating. We need to help kids learn how to have healthy relationships, how to speak up when they're anxious, when they're feeling ashamed, when they're feeling overwhelmed. And now, whether or not that's because the parents failed, or the culture failed, or the friends failed, or the community failed, doesn't matter. We've all failed if we haven't helped our kids learn how to speak up and do what they need to do to get their feelings taken care of appropriately. If we let that go, we're teaching them that they should continue to suffer on their own, so they're eventually going to do something to not suffer, like hang out with people who are suffering in the same way because birds of a feather, and then go start using. That's just basic logic. So my proposition is this. Let's help our kids get healthier. And for those of you who are struggling with drugs and alcohol right now or in recovery, let's continue pushing for healthier and healthier relationships that help the orbital frontal cortex heal, that help our dopamine system become more regulated again, that help our opiate system heal. Because healthy relationships are the foundation of our ability to feel safe, to feel comfortable, to feel understood, and to manage our feelings. So if we push for healthier relationships, even if your relationships are good, we'll help our community heal. So I hope all this is clear. And anything that you have a question about, please feel free to message me, and I'm happy to expand on it or clarify anything. I just want to talk about the two myths real quick, again, that I've alluded to here. The first one is the idea that addiction is not a disease. Again, technically, if you read the neuroscience research, it is a disease. Now, whether or not someone is an addict because they're using drugs and alcohol is up for debate. And I can't know that, and you can't know that unless you're in their mind and you see the consequences of their behavior. So that's the first myth. The second myth is that kids should be able to use as much drugs as they want, and it's normal to experiment and all that good stuff. So while it is normal for kids to want to experiment, it's abnormal for them to use substances in any kind of consistent way because it hurts their brain's ability to develop. And that's a research fact, not an opinion. I'm not some pro-sobriety, Nazi. My goal is to help kids develop healthily and let their brains do their job, let their white matter in their frontal cortex develop appropriately so that they can feel safe, reach out in relationships in order to get their needs met so they don't have to run away into drugs and alcohol. Okay? Those are the two myths that I want to leave you with as completely invalid. That kids are fine if they're using drugs, and that addiction is not a disease. And I really appreciate you coming out and commenting. I know I haven't been able to respond much to your comments here because I've been so kind of focused on this. I'll respond here in a minute, and then I'll post the research on Patreon here coming up. I appreciate you all listening. I look forward to more discussions about this topic. It's very, very important to me, both for my work and myself as a person and my family. So I hope that you take what I say seriously and understand that I'm not trying to do any kind of propaganda-based discussion here. I'm really talking about the research, the scientific research, not just ad hoc and ad hominem stuff, okay? I hope you all have a great day, and I look forward to chatting with you again soon.